I think what the President managed to do this evening was to make certain that everyone knows that standing still on health care reform, on insurance reform, is simply not an option for us at this time. So with that, I'm happy to take any questions that I can answer. I will. Any observations that you'd like me to comment upon, I'd be pleased to do that as well.
Paula Akana from KITV. How do you feel about getting it passed, though? I mean,
I feel very, very optimistic about it. I did speak to a number of my colleagues, and the way I summarized it was the President gave almost everybody in the Congress who wants to have health care reform a place to stand tonight. Everybody got a place to stand. Everybody's issue or concern was addressed, I believe, in very straightforward and powerful fashion by the President tonight.
Yeah, Congressman, this is John Yockey with the Advertiser here. I'm up with you here in D.C.
Yes, John.
Yeah, he never really pounded the gavel on the public option. He said that was a means to an end.
Yes.
And you could argue that was a little bit of tap dancing around it, but I mean,
maybe some would argue I didn't, and I don't think anybody of progressive persuasion felt that was the case. On the contrary, I think we concluded that he stated it very, very well. He found the niche for that, if you will, and said he would not back down from it. I wouldn't characterize. I've got the President's speech right here. I don't have the exact page, but I think I could find it fast enough, where he said, essentially, make no mistake about it, there will be a public option availability in this in the overall picture. It was not going to be the sole focus of health care reform or insurance reform, but it was going to have a definite role to play and would be integrated with the other items that he enunciated tonight.
Yeah.
Go ahead.
Yeah, so that, at least for now, was clear enough for you. I mean, what do you think as you look over at the Senate Finance Committee, where there is talk of insurance exchanges, but I think Senator Baucus made it clear as senators ever make things today when he said that a full-blown public option is just not happening over on the chamber.
But full-blown excessive rhetoric may be involved in that. Inasmuch as the public option was always a work in progress, it was being defined as we went along, and I think the President outlined the boundaries tonight, and I think they're quite satisfactory as far as I'm concerned. And whether or not Senator Baucus has concluded the same, I can't say. It'll manifest itself next week. But I think the President gave a very clear path to that Senate Finance panel to come up with a public option proposal within those boundaries that he set tonight. I think what he did was really masterful in this sense, that he came to the Congress with the idea, okay, you folks shape it legislatively. I'm not going to come in here and dictate to you. He's seen the results of that, some of which have borne fruit, I think, in the sense of no pre-existing conditions. I think that's an agreement. He was quite solid about that tonight, saying that it's going to be illegal to have insurance. That's his proposal, to be illegal to have insurance that did not include the idea that no pre-existing condition will sever insurance for anybody, onto the public option and what shape he thought that would take. So Senator Baucus and his committee now have an opportunity to join in that. There are 5 committees, 3 in the House, 2 in the Senate, handling this. No one committee will have the final say. It's going to be a synthesis, a melding of various proposals in all of these bills, and I think the President put final shape to that tonight.
Congressman, this is Herbert Sample at AP.
Yes, sir.
To follow up on John's question, can you vote for a measure either out of the conference committee or out of the House that does not have a public option provision in it?
But it will. I believe it will have a public option. I am for what the President outlined tonight, and a public option, according to the President's own words tonight, is a position that he sustains, that he supports, and that he does not want to have a bill come forward that does not have that. Now, what constitutes the public option obviously is still going to be shaped in the days to come. but the outlines and the boundaries for that are clear from the president's talk, and I think they're becoming more and more clear as the committees examine the various proposals associated with what would constitute a public option. I just think that's going to become less and less of an issue as we move towards a final resolution of a bill. It may be that public option as originally conceived and enunciated and defined 2 months ago, a month ago, a week ago, maybe that would have been the case. But I have an idea by the time the final bill arrives for voting that Senator Baucus and others may find that the redefinition of public option is such that they'll be able to support it. I certainly hope so.
Opponents say that we don't have the $1 trillion to pay for it. Do you think that the president adequately answered some of those questions?
Yes, he was quite adamant about it, as a matter of fact, about not only how to pay for it. I find it very, very interesting that people who are suddenly concerned about paying for it, as the president indicated, weren't very concerned about the tax cuts that were passed during Mr. Bush and Mr. Cheney's administration that were never paid for, which drove us into this debt. They were not concerned about seeing to it that we had adequate regulation, the way the president's going to do with insurance companies right now, to make sure that they deliver for everybody. So it's a little difficult for me to take seriously somebody now being concerned about paying for something when they never had a clue about it or a care for it in the past. The plain fact is that precisely because of defensive medicine right now, costs are a great deal higher than they need be, and that there are going to be a lot of savings there. That's agreed by medical professionals, it's agreed by actuaries, it's agreed by the hospitals. We think that particularly by spreading out the insurance among everybody, that those of us who are now paying for the uninsured, which is what happens, that's why our premiums are as high as they are, because millions upon millions upon millions of Americans are showing up in emergency rooms at very, very high cost because they don't have insurance. And so we're paying for it. That cost is merely shifted to those of us who do have insurance right now. So when you spread it out among everybody across the country, by volume alone, you're going to be lowering the cost. So I'm quite confident we can put together a game plan that will make that happen. 3
House committees have already passed their versions of the bill. Given that this is now early September, where does Obama's version get into the process here? And do you think he waited too late to make this speech?
I think the timing was just about right, for the simple reason that, again, as he indicated in his speech, we've gone further with more detail and more breadth of perspective on health care reform than any Congress has done since Teddy Roosevelt first proposed a national health care plan almost 100 years ago. This is the most comprehensive, in-depth, broad-based approach that has ever taken place. So it's not surprising then that there would be quite a bit on the table. And that now is the time then to pull these ideas together and to put a bill together. We have several versions of bills out there right now, some more extensive than others, but as long as we get, and I'll hold it up again so everybody can see it, the president's plan, and the summary of it is very, very clear. We'll have a health plan, a health insurance plan that will provide more stability and security, that will have quality, affordability, and choice for all Americans, and we're going to rein in the cost of care for our families, business, and government. So the idea now is to take the various proposals or sets of proposals and put them into a context which mirrors these 3 essential principles, if you will, of cost containment, of quality and affordable choice, and stability and security for those who have insurance right now. It's such a pleasure to be seated in the Congress knowing that the President was born and raised in Hawaii and that he reflects the values of aloha in It's a perfect example of diversity defining us rather than divide us, that the diversity of views around health care is going to define genuine reform and not end up dividing us as it has for so many decades now.